Good evening, everyone. I am Dr. Amit from Bilaspur, Chhattisgarh, reporting for IRACON-TV. And we are very lucky to have with us Dr. Harsha Gunawardena. He's from Bristol, UK. And welcome to IRACON 2023, sir. So, how are you today?
Thank you. I'm very, very well. It's a real pleasure to be with you in Hyderabad in India. I arrived yesterday morning from UK in Bristol, and I've enjoyed the conference so far. It's been fantastic. I was here yesterday afternoon and helped chair the CTD-ILD workshop, which is a really great experience. Met some pulmonologists and lots of rheumatologists who are interested in my field of CTD-ILD, and it was nice to see lots of trainees there as well. Yeah, learning about the basics of CTD-ILD. So it was a great session.
And overall, how do you find the scientific program of IRACON this year?
So I've just obviously been here for the day so far. It's very varied. It's a great wide practice, great timetable. My particular interest is obviously CTD and vasculitis, so I tend to concentrate on those areas. But I can see, looking at your program, it's a very wide spectrum. It's great.
So today also you are going to speak upon CTD-ILD, and tomorrow you are going to speak about myositis. So what are the two to three keynotes or messages, important messages you want to highlight?
So for my talk this afternoon, I'm going to discuss CTD-ILD. It's one of my passions. Is we run a service in Bristol in the UK just specifically for CTD-ILD patients. It's a combined service that we run with two dedicated CTD vasculitis physicians. That's myself and my colleague, Dr. Pauling, alongside two dedicated ILD physicians. And I think the main focus of my talk will really to emphasize to the audience the importance of multidisciplinary working. Right. This is a complex group of patients, whether that be a patient with myositis or systemic sclerosis, or even lupus with lung disease. And they are very difficult, heterogeneous groups of patients. Not every patient is necessarily the same. Right. And having that joint expertise where you can work with pulmonologists with an interest in ILD, ILD radiologists who have an interest, histopathologists who have an interest. You'll see from the premise of my talk, there's a real focus on that importance of multidisciplinary working, not just from a medical perspective, but pharmacy, palliative care support, specialist nurse support. And I'll share with you our practice in Bristol. We're very fortunate to have a system where we can create these multidisciplinary teams to look after patients. The talk will also cover treatments and the different treatments or combinations of treatments that we use, from the very common to steroids, cyclophosphamide, rituximab, to some of the more novel treatments that we're going to be potentially using in the future. And then part of the talk will also concentrate on assessment, because assessment of these patients is crucial. Not every patient requires treatment, and knowing who needs treatment with assessment, in particular robust lung function, antibody analysis, and interpretation of CT is really important. And that brings it all together. And all that information feeds into our MDT, and then we can make a treatment decision about a patient.
So, right, that's great, sir.
And then the second talk tomorrow, again, great.
Again, very interesting talk.
Thank you. Great to be invited. So, you probably know my other passion, my other expertise is myositis. It's linked in with my love for interstitial lung disease. So my interest in myositis dates back to my PhD. Back in 2005, 2006, 2007. My PhD was an antibody discovery in myositis. So you're probably familiar with some of the antisynthetase antibodies, in particular anti-ZO. Right. That was an antibody we discovered.
That's great, sir.
When I was doing my PhD. Anti-SAE, that was the index cases for SAE were first discovered and first published by our group in Bristol and Bath. So it's great to be able to present that. But the talk really tomorrow is going to focus on not managing patients with difficult myositis, as Rohit has done that very eloquently in the talk in the previous session, just literally an hour ago. But I'm going to concentrate on management of extramuscular complications, and I'm going to do two case presentations. A patient with very difficult skin and gut failure in myositis, with total gut failure and how we manage that. And then the second patient is going to be what we all often see with dermatomyositis patients. It's a patient with really difficult calcinosis, and how we managed her. And I'll share my experiences on the different treatments that can work, that may work, and some of the novel treatments that are coming up.
So really looking forward for your talk, sir.
Thank you.
So my next question is, now we have so many research going on in the field of rheumatology. How do we manage to stay up to date? Means there are so much to read about and so much we have to know about. Yeah. So it's really difficult. I don't know, means how do we manage it?
It is really difficult. So I'm primarily a clinician. I have very little academic time. Most of my job is either a clinical medicine or management now, and I don't have dedicated time in my timetable for academic work as such. Okay. So it's difficult to keep on top of things.
Yeah.
And I mean, ultimately, we all pick things that we like. We all pick things that have our favorite subjects, and I tend to concentrate on those. I can't keep up to date with everything. It's impossible. So I always try and keep up to date with CT and vasculitis. How do I do it? Well, come to conferences like IRACON, go to the ACR, go to EULAR, go to the BSR. I don't like it being called X anymore, but I used to love Twitter. Where was Twitter? Because actually Twitter's a great way, if you follow the right people, of keeping up to date with research. You'll often see snippets on Twitter of a paper or a conference talk where you'll think, actually, that's really interesting. And then you can look at it again. So social media is a great way of keeping up to date. Going to conferences, networking, talking to colleagues, collaborating, another great way to keep up to date.
That's great, sir. And on a lighter note, I would like to ask that what are the good and the bad thing about being a rheumatologist?
Oh, gosh. So the good thing, it's relationships. It's relationships with colleagues. It's relationships with our patients. That's what I would say, very simply. Probably biased, but I think rheumatologists are generally really nice people. Yeah. We are very supportive, generally very gentle characters, and I think our priority is management of patients. So I love coming to meetings. I love working with colleagues. So I think that's one of the best things about being a rheumatologist is the people who meet and the relationships you make. Same thing with our patients. I mean, we're in that specialty, aren't we, where we're fortunate enough to meet patients who we look after for years and years and years. And I think that's really nice. I became a consultant in 2008. Only the other day I did a clinic in October 2023, and a patient said to me, "How's Luca?" Luca's my eldest son. And she first heard about Luca when he was 1, and Luca's now 20. And she remembered my son. 19 years later, I see her once a year for a checkup, and the first thing she said to me was, "How's Luca?" So that's lovely, isn't it? That relationship with patients. We see them through journeys. We have challenges. We have successes with them. And I think we're very privileged to be able to develop that relationship with patients.
That's great, sir. So this was Dr. Harsha Gunawardena, and it was nice talking to you, sir. So I am Dr. Amit Dua signing off for IRACON 2023.